Okay, so now let's move on to the ESC definition of advanced heart failure. So there is an actual definition for advanced heart failure, as you can see, even though mostly in the clinical setting it's loosely used term. So you need to have all four of these criteria. So first one is the symptoms, so NYHA 3B or 4. I'm going to jump straight to the fourth one first, which is the severe impairment of exercise capacity. So 6-minute walk test less than 300 meter and peak VO2 less than 12 to 14 ml per kg per minute. So these two are how the patient feels. Then number two is cardiac dysfunction. So you can have left-sided heart failure with EF less than 30%. You can have HFpEF, you can have RV failure, or you can have non-operable severe valvular disease or congenital heart disease. And you only need one of these to qualify as cardiac dysfunction. And then the third one is any hospitalization that's heart failure related in the last 12 months or an unplanned visit. So when you have all four of these, then you can define this patient to have advanced heart failure. Okay, so finally, let's discuss the INTERMACS profiles. These profiles were developed initially because there was a need to further characterize these advanced heart failure patients, to prognosticate them and also decide on what temporary escalation in mechanical circulatory support or need for heart transplant or VADs was needed. So this is defined as profiles 1 to 7, and then there are three modifiers that can be used. So profile 1 is basically a critical cardiogenic shock. It's nicknamed as crashing and burning patient. In this patient, basically there will be critical hypotension or hypoperfusion despite rapidly escalating inotropic support or a balloon pump. Intervention in this case will be needed within hours. Second profile is that of a progressive decline, also termed as sliding on inotropes. So this patient is already on inotropes and yet there is a slow yet progressive decline in their clinical status. So it's not a critical decline over, for example, a period of hours, but slowly you can see that they have worsening kidney function, nutrition, or they're not able to maintain the volume status. And this can also be with patients who have a temporary MCS in place. Third profile is that of a stable but inotrope dependent patient. So this is nicknamed as dependent stability. So their parameters, for example, kidney function, nutrition, volume status is able to be maintained with the use of inotropes. However, whenever you try to wean them off the inotropes, they deteriorate in terms of symptomatic hypotension or renal dysfunction. And intervention escalation in this case will be typically needed in weeks to months in terms of, for example, a durable VAD or a heart transplant. The rest of the classification profiles are basically ambulatory setting. So fourth one is resting symptoms, similar to NYHA4. They have symptoms at rest and with any minimal activities of daily living, such as dressing and bathing. Profile 5 is that of exertion intolerance. So they cannot tolerate any kind of exertion, but they're asymptomatic at rest. These patients will be homebound, they're not able to go out and engage in any kind of activity. Sixth profile is that of exertion limited patients. They are able to tolerate some mild activities like going out with friends or to a restaurant, but no meaningful physical exertion. And then lastly, there is the advanced NYHA3 type. And in this, patients can tolerate some minimal physical exertion, such as walking about a block or so. Now, there's three modifiers that you can use. Modifier A, which stands for arrhythmia, is for sustained VT or VF requiring, for example, ICD shocks, typically about more than twice in 1 week. So they're having basically malignant arrhythmias frequently. And this can be applied to any of the profiles. So for example, you might say this patient is a profile 3A. A second modifier is TCS or temporary circulatory support. This is mainly for profiles 1 to 3.
in patients requiring temporary mechanical circulatory support. And profile FF is the frequent flyer, which is for profiles 3 to 6. In this, there's a frequent hospitalization, which is defined as more than equal to 2 in 3 months or more than equal to 3 in 6 months.